You're listening to The Scope, a podcast dedicated to having open conversations about healthcare topics relevant to our patients and community. Today, we'll be discussing a year-end review for Phelps Health. Let's get started. Hello to all of our listeners out there. I would say good morning because that's when we're recording this, but you may be listening in the afternoon or the evening. Today we have two special guests, Jason Shenefield. He's the president and CEO of Phelps Health, and we have Keri Brookshire-Heavin. She is the senior vice president, chief nursing officer, and chief operating officer here at Phelps Health. Welcome to the show.
Good morning.
Yeah. Well, we're glad to have you guys with us. To kick us off here, why don't you guys tell us a little bit about yourself? Keri, why don't you go first?
Okay. My name's Keri. I have been here at Phelps Health since 2005, and I've been in my current role as Senior Vice President, Chief Nursing Officer, and Chief Operating Officer. That's a mouthful. For a little over a year now, I guess. So I'm from Rolla. I actually was born at this hospital, and I have two teenage boys. Well, one is not a teenager anymore, but one is a senior. And I have two fur babies. So that's kind of my story, I guess.
Awesome. That's great. And Jason, why don't you tell us a little bit about yourself?
Okay. So I've been with Phelps Health for a little over 6 years now. Originally came here as the Chief Operating Officer and have been the CEO for about 15 or 16 months now. So we lived in Rolla for the past 6 years. I've been married for 22 years, and we have 3 children. One, my oldest, is our daughter. She's in college at State Tech. And we have 2 boys. One is a freshman in high school here in Rolla, and the other is in 6th grade.
Awesome. All right. Well, thanks again for coming on our show with us. We're nearing the end. We're nearing the end of the year, so we thought this would be a good time to talk about what has happened in 2022. And as we'll talk about, a lot has happened. This has been a really busy year, and we'll also talk a little bit about what we can expect looking forward to 2023. So as you guys mentioned in your intros, you both have been in your current roles for a little over a year now. How would you describe your first full year in your respective positions? Jason, do you want to start?
Yeah, I would describe the first year as really just focusing on where we're heading as an organization. And I think that, it takes time to really get everyone to understand the direction we're going. But I think that, that's been important to really focus on our strategic plan. And, we do have 3 pillars to our plan, which is our people, our patients, and our organization. And I think in the first year we really focused on all 3, but specifically on our people, because I think if we can get our culture right and we can get everyone moving in the same direction, it makes it much easier to really transform the organization moving forward.
Okay. And Keri, how would you describe your first full year in your new position?
Busy.
Yes.
I think I would agree with Jason, and I think this has been a big year for change for the organization. We've had a lot of change, different format for things. I think just a different administrative style. We have gone through a pandemic, and we're trying to recover from that, and really just trying to get our focus again on the strategic plan, on our people and our patients and our organization. And I think it's been a good year. I think there's a lot more to come. I'm excited about things coming, but it's been a full year, that's for sure.
Yeah, so you mentioned change, and change can be really exciting, actually.
Yes.
It doesn't have to be scary. So I think that's, like you said, I think the year of change is a good way to describe that. So you guys actually had a great segue into my next question. I talked about the 5-year strategic plan. We actually started that in 2022 here. Can you provide us with an update since we've been 1 year now into the strategic plan and any accomplishments that maybe we've made so far?
Well, I think that as far as updates, we will give an official year-end update after the year actually ends. What I can say is I feel like we're really starting to gain momentum. Patient experience, for example, is on the strategic plan, something that we have struggled with for quite some time, getting our scores where we want them to be. We're starting to really see improvement and momentum gathering for those initiatives. So I think we're moving in the right direction. We have to continue on that path, not losing focus. And that's something that we have to work on. That's something that we have done in the past as we lose our focus. So we do have measures that focus on quality. We're doing well with those. in using Epic and the quality and safety features that Epic has to offer. MyChart and having our patients enroll in MyChart, we're moving in the right direction. So I think really positive changes. What we will see is additions to our strategic plan in 2023 that are focused on health equity and community health and wellness. Some of that's regulatory that we have to do, but it's actually really exciting to think that we are going to focus on things that really impact the health of our community and our patients and how they access us for care. So more to come. I think we'll revisit that probably in the first town halls of next year.
Okay, awesome. So, Jason, you were, I think, recently quoted in one of the articles, healthcare is an ever-changing field. So I think I know Keri talked about there'll probably be some updates to the strategic plan since healthcare is changing almost by the day, every day. I think it's important to have that flexibility, it sounds like, in that strategic plan. So, yeah. Okay. All right. Another initiative I wanted to talk about was Project Impact. And so Project Impact, for those of you who don't know about that, is a huge cost savings initiative for Phelps Health. Can you give us an update on Project Impact?
Yeah, I can touch on Project Impact. And it really has started about a year ago when what we were seeing in the industry was just, cost of everything. So pharmaceutical cost, supply cost, labor cost was going up, and we recognized that we needed to make an investment in our employees, and we did that by increasing our minimum wage to $15 an hour, which was a big investment, over $5 million just in salary adjustments, but we also knew that the way we were financially performing, we couldn't afford it at that time, but we went ahead and did it, and really with the commitment that we were going to find that savings plus what we were seeing as reductions from some of our governmental payers, we knew we needed to find at least $8.5 million, and ideally to get into alignment from other comparable hospitals from a profitability standpoint. We needed to find at least $14.5 million. And it was really a combination of both expenses or looking at, are there ways that we can improve our revenue, just capturing for work that we're already doing, and really taking an organizational approach. Project Impact, we identified almost $19 million. And really a lot of those things are being implemented and have been implemented, and some things will continue to be implemented through the first quarter of the year. But we're starting to see that as a positive impact to the financial health of the organization. And really we've had actually the last 5 months, we've been at a positive in the finances, where prior to that we had several months where we were at the negative. And so it's really important just for the financial stability of the organization so we can be here long term to meet the needs of the community.
Okay, that's great. And it's great to see that we're already seeing an impact from Project Impact, I guess. So, okay. All right. Another program that was implemented this past year is the CARES Award program. So I want to start off with a simple question. What does CARES stand for?
CARES actually is our values. It stands for compassion, accountability, respect, excellence, and service. And it really represents what we want all of our employees to really represent to our patients and represent for our organization. Okay.
And so can you kind of talk about the CARES Award program? What is it? And then how can people maybe nominate staff for an award?
Sure. It actually is a recognition program that came about through our Employee Advisory Council. And it's focused on employees recognizing each other and also recognition of an employee from a patient, a visitor, so that we call that the We Caught You Caring Award. So we have two paths for the CARES Award, and then we also have a Department CARES Award. Sometimes you don't necessarily recognize one person, it's a whole department that does the great work. So we can recognize the department as well. You can actually nominate anyone or a department for a CARES Award from our portal. If you go to the portal, there is a box that says CARES Award. If you click on that, you can enter information. It is short and sweet. It just takes a minute, and it's a great way to recognize your peers. The program's been successful. I have entered several CARES awards, and I started thinking I need to make sure it really does just take a minute or two, and it does. It does just take a minute or two, but it has been a fantastic way to share praise and recognition to staff.
Mm-hmm.
Yeah, that's great. So, I also want to add for any patients or visitors who want to nominate it, you can go online to phelpshealth.org to nominate it, or you can ask your care staff. We also have cards that you can write your nomination on as well too. So, but yeah, that's great. So, okay. My next question is actually something you mentioned, Keri, is the Employee Advisory Council. This was also a new initiative that began this past year. We call it the EAC for short. So what is the EAC, and what are some achievements this group has made so far?
So the EAC is the Employee Advisory Council, and it's made up of 30 members, and we try to really make that group representative of our whole organization. So we have clinicians, non-clinicians, night shift, day shift, some business office, some support departments. We really just got a variety of members. They had to apply to be on the council and submit why they wanted to be part of this group, because we really wanted people that were invested and wanted to make our place a better place to work. So this group has met every month, and they've been very engaged in trying to make our organization the preferred employer. We have worked through the dress code policy. We've added hospital branded t-shirts this year.
Awesome.
It's a running joke because I am a pretty conservative dress code person, and they like to give me a hard time about being able to wear t-shirts. So they actually came up with the CARES Award. We replaced our old recognition system with the CARES Award, and this is something that group has really championed and really they kind of came up with a design and what that would look like. So we're very proud of that. We've done some other policy type changes from that group. We have allowed, for example, our employees that have to take off for holidays because their department's closed. Now they can choose, do they take PDO or do they not take PDO? Things like that maybe impact employee satisfaction directly. And we have broken into subgroups to focus on different areas. So there's a group that focuses on HR things. There's a group that focuses on facilities, for example. So they have gotten additional lighting in the parking lot where employees maybe feel like they need more light to feel safe. Things like that. So those groups are all working on different projects. It's been exciting to see them get involved through the year. And this group really evolved from us leading the team to they are leading themselves, which is what we want. That's kind of our philosophy, is to have the front line making those decisions and leading that effort.
Awesome, that's great. So yeah, and I'm excited to see what they're going to be doing for 2023 as we said as this program evolves. So, okay. Jason, my next question is for you. Again, another new program we started this year was the Community Connections events that we held. And I think we held 2 of those in 2022, correct?
That is correct.
So tell us more about Community Connections, and what do the people who attend these events, what do they learn?
Okay. Well, I think Community Connections, the reason why I wanted to start this was what I felt in this role was I needed to be more visible in the community, connect with business leaders across the community, and really, talk more about what we are doing, the good things we're doing, and also answer questions, rumors, myths that are out there. And so it's really just an opportunity to get in front of business leaders in the community and do that. You're correct. We've done 2 of them this year. Our goal is to try to hold one approximately every quarter. So try to do at least 3 or 4 a year, and each time have different people come. And I think as people, now that we've done 2, the feedback has been very positive. People have really appreciated that we've taken the time to invite them in, to have a conversation, answer questions. And what I've really been impressed with is just their engagement when they come to these discussions. But it really is it's a casual conversation. I provide some information about what we're doing just to get things started, but really, want the group to engage and ask questions, Because, again, I think like with a lot of things we're doing, the more we can understand what people think or what they perceive, and we can, figure out how do we improve or how do we, address those things, the better people will understand the good things that we're doing within the organization and across the community.
Okay, that's great. So, yeah, and just I mean, Phelps Health, we're a part of this community, so I think this community outreach is really great that we're doing this and reaching out to the community for these events like that. So, okay. So another thing that happened this past year, it's been 2 years since we launched the Epic electronic health record. Can we talk about what are some of the achievements we've made to the electronic health record now that we've had Epic for 2 years?
So that's a great question. I think achievement-wise, I think first we have to just acknowledge that we even started Epic in the middle of a pandemic with a remote support, essentially. So our staff have done fantastic with adjusting, and I think this year we've spent adjusting to workflow changes, but also to now we're starting to continuously improve. So we've implemented Beacon, which is for cancer care.
Okay.
We are looking at, we're using some handheld equipment now that allows us to provide care at the bedside or at the patient level instead of having to be away from the patient.
Okay.
So we are constantly doing things. Epic allows us to benchmark or compare ourselves to other hospitals that use Epic, and we get ratings based on what do we use, what functionality do we adopt, and then how are we doing compared to other organizations. And those things are also part of our strategic plan. So it kind of all goes together, which is what you want. You want that to all flow together. And we're doing well. We are above the median in both of those areas as far as how we compare to other Epic hospitals. So I think continuing to look forward, because Epic, one thing about Epic is they are continuously growing what they offer. They are all about the latest and greatest and trying to improve care, trying to improve efficiency and just technology in general. So I think we will just continue to see that grow and improve as we have that product.
That's awesome. So, you also mentioned earlier, I didn't want to end this topic without talking about MyChart. This is that's a great patient portal. Like I said, so if you guys don't already have that, make sure you sign up for MyChart. You can message your doctors. You can refill prescriptions through MyChart. You can schedule appointments. It's a great tool for patients.
It is great. You can see your test results and labs. It's a great way to get information.
Yeah. So that's great. Okay. Alrighty. We've talked about so many new initiatives we started this year. Another one that began in 2022 is the Bright Ideas program. So can you guys explain what is the Bright Ideas program?
So Bright Ideas is it was something that to really keep the ideas from Project Impact coming, to leadership so that we could continue to be just good stewards of our resources. And so really Bright Ideas was created with the intent that employees could continue if they saw whether it was cost savings or a process change that would either save dollars or improve something that we're doing. And so essentially what we do is employees submit those ideas. They try to quantify what's the potential savings or if there's a revenue improvement, and we look at is it something we can really do? Is it something that is a good idea? And I actually had attended a Bright Ideas meeting earlier this week, and it was amazing the number of ideas that are out there. And some of them may be small dollars amount, but a lot of times even the process change is really a good idea. And so what we do is those things that we implement, once we validate that it results in a savings or an improved process, employees can get up to 10% of whatever that amount is, up to $10,000. And so really it's just trying to keep that spirit of, keeping your eyes open, your minds open to how can we do things better, how can we be good stewards of our resource, and then really paying it back to our employees for helping get those ideas to us so that they can be implemented.
Okay. So, and do you have any examples of any Bright Ideas that either have been implemented or are in the process that might be implemented in the future? One
idea that I had listened to this past week was, I guess there's devices that we use in the nursing floors that we change out the batteries every single time that they're done using it. And sometimes a patient may not even use it for very long, and they know that, the batteries can't be bad. And so really looking at, how do you maximize the use of the batteries so we're not throwing away when we know that they're not bad. So it's good for the environment, but it's also a cost reduction. And so really we actually looked at that and we said, well, there's a cost savings, but it's actually a process we need to look at to make sure that we're, providing, not affecting the quality of care or, patient safety. But in talking about it, I was like, this really is a good idea that, someone that is doing this and identifies that, that this may not be the best way of doing it, would we ever really know about it?
Right.
And so even though it's a small amount, I think it's a great idea that someone brought forward, and we're going to evaluate the process, make sure that we find a process that works well, and then it's probably one that I would anticipate would result in a financial reward for that employee for bringing it forward. So that's just one example that came up just this week. So
okay, yeah, I think that's great, awesome. Okay. Another new committee, I guess that has started or recently been implemented, is the Executive Projects Committee. So can you explain what this committee is and how it benefits the organization?
So the Executive Projects Committee, the main goal of that is, as we talked about, our strategic plan. And the challenges around strategic planning in healthcare is it's hard to look, it's hard to even look a year down the road, but it's hard to look 2 years or 5 years down the road and say, here's all the things we need to do to be successful. And so with the Executive Projects Committee, it's really more real-time planning. So we stay focused on what our goals are, what the organizational needs are, as ideas come up or as things come along, whether it's a regulatory change. We take it to our Executive Projects Committee of what that idea is. And as an executive team, we agree on, is it something we need to do? How does it impact our strategic plan? Is it the right time to do it? And if it's not the right time, when is the right time to do it? But it really gets the entire team, which when we say the executive team, they really represent all the departments of the organization. And so we're really making decisions about what our priorities are that helps us achieve our strategic plan as a team, and really it does it in kind of real time. And so our plan doesn't become stagnant because we're constantly talking about what do we need to be doing, and even more importantly, trying to prioritize. So there's so much going on in healthcare that if we don't do a good job of trying to prioritize and make sure that we're balancing the amount of work with what we need to get done, just trying to help people have balance in how much we're taking on at one time and staying well coordinated.
Okay, that's great. Well, if you haven't figured out already, 2022 was a really busy year. We had some other things that happened this year. One was we completed a community health needs assessment this past year, and so this is required to be done every 3 years, and so this just happened to be that year. Can you guys tell us what is a community health needs assessment?
So the community health needs assessment really is, we actually engaged an outside company to come in and survey a representative piece of our population about what they think are, well, we look at a number of things. So we look at what people think the community needs, but we look at our demographic of patients and where do they sit as far as socioeconomic status. Are they insured? Do they have a primary care physician? So that we can really identify what does the community need from us to maintain health and wellness. So it's really kind of exciting. The federal government and Joint Commission are getting on the bus with community health and health equity. And we are going to focus on health equity this year, which is really about leveling the playing field for people to get health care so that everybody has equal opportunity to even get to the health care. And then once we're there, we can look at that community health needs assessment and determine what is our community really needing from us. If we don't assess what's there, what's available, and what is needed, we may not meet the needs that the community members have. So that assessment is ideal for driving us to serve the people of the area better. Two of the focuses that we really identified are access can be an issue for definitely a part of our population, and then just general wellness activities in the community as well.
Okay, so well, that's great. So I like what you said. Just, I mean, this helps us understand what the community needs out there, and then make sure that we have those services to meet those needs. So that's really important. So, okay. And another assessment that took place this year was the brand perception survey, which I don't think we've done for several years. Can you tell us a little bit about what was the purpose of that brand perception survey? And if I don't know if you could share any of the results of that survey either.
Yeah, I mean, really, the purpose of the brand perception survey is just understanding how basically what it says is how does our community perceive us, and so looking at how do they perceive our services. What are things that we do well? What are things that we don't do well? And I think that anytime you go out, anytime an organization goes out and asks for feedback, you're going to hear a little bit of good and bad. And so I think really, it helps us look at what are we already doing? Are we doing things that's going to help address some of the concerns? Is there anything that we learned from that feedback that we weren't aware of and that we need to pay attention to? And I think the good thing, we actually just presented this feedback to our board last night, and I think really looking at it is there's both good and bad information, but there wasn't anything in there that I felt like, oh, we're completely missing the boat on. There's things that we definitely haven't fixed yet, or that we haven't we haven't gotten it to where it needs to be, but I think as Keri talked about earlier, the momentum or the strategic plan, it just feels like things are all moving in the right direction. It feels like we're getting alignment, and that as new things come, and even with health equity and the community health needs assessment, it just feels like pieces are falling in place, which again I think just goes back to we're more fluid, we're more nimble, and we're listening. We're doing a better job of listening what's going on. And that just helps things fall into place. And I think that's really what I was pleased about with the perception survey was it feels like we're on the right track. We still got a lot of work to do. It's not going to be completed in 2023, but I do think we can make progress, and we're moving in the right direction. Okay.
So, and just like a lot of the other things, the strategic plan, Epic, this is an ongoing thing. So, like you said, this will be probably seeing some changes over the next couple of years. So yes. That's great. Okay. All right, now we're going to switch gears a little bit. Since we're recording this, like I said, in December, and so we're unfortunately we're right in the middle of flu season, as well as some other respiratory illnesses going around. So, can you talk about the state of COVID-19? I know there's also been some cases of RSV and flu at Phelps Health. Where are we at right now? And if there is to be another wave of COVID or some of these other respiratory illnesses, is Phelps Health prepared to deal with that?
Sure. We definitely are seeing more patients that have flu and been diagnosed with the flu. There's a lot of that in the community right now. Okay. We are seeing more COVID at the moment and hospitalized with COVID. So I don't think we have a trend yet, but we are watching that closely. Okay. I think one thing the pandemic taught us was how to be flexible and adjust. Yes. Because we did have to really adjust things to deal with a surge. So part of that was planning, so that if that ever happens again, we'll be ready to adjust and allow that surge to happen and still take care of patients. So we do watch it closely. We've seen volume increase in the emergency room and in the immediate care settings. So we have patients using our services, which is great. I probably wouldn't be a nurse if I didn't say, good hand washing is good. If you're sick, stay home. Things like that. Make sure you're practicing those good habits as well, so that we can hopefully prevent spreading those conditions.
Yeah, those prevention techniques I think are great. So, I've also heard too. I don't think it's ever too late to get a flu shot. I mean, I think it's better to get one than to not get one at all. Yes. So, so that's also a great prevention method. So, okay. So 2022, we also saw a lot of constructions and facilities updates to our campus. I was wondering if you guys could talk about maybe some of the big projects that we completed this year at Phelps Health and in terms of our facilities.
Sure. Facilities is it's an action-packed place. I have got to work with facilities more over the last year, and it's been exciting. So we have had several moves. We did move our wound clinic into a new area. We have a new sterile processing department. As many people saw, we had a groundbreaking because we're going to have a new EMS space this next year, or start working on that. And then we are really busy right now doing things in the facilities to prepare for surveys and to move some things around in our clinics. There's going to be some moving and shuffling. We are in full swing in our infusion room on medical oncology. That's under renovation. So that should be done in the next couple of months. We're excited about that. We also have we're on track to finish our expansion for DDCI pharmacy as well. As they've seen more patients, they need more space, so we've expanded that. So it's ongoing. It never ends. There's always something, and some days it's like a puzzle fitting all the pieces together. But we have a great facilities department. They do a great job keeping track of everything.
Yeah, that's great. So we're about to wrap up on this podcast. I thought hopefully I wanted to end with a question. Basically, what's in store for 2023 for Phelps Health?
That's a good question.
Yeah. Well, I think really it's, a lot of things we've talked about as far as I am really excited about the health equity and diversity focus, the wellness focus, and again, just seeing us progress as a health system, but also really making sure we're extending out into the community, the things that we can provide, and again, trying to, find ways to provide value when people may not be thinking about healthcare or what their needs are for healthcare, but yet we're still there supporting them. So I'm excited to see that. I also think what I'm also excited about is a lot of these things that we've talked about is going to take community collaboration. So working with other healthcare providers, other organizations in the community, and really figure out how do we leverage all the resources and really work together. So I think that, to me, is one of the most exciting things looking forward into the next year.
Well, that about wraps up our podcast today. So again, Jason and Keri, thank you so much for stopping by and giving us an update and a little year in review here of 2022.
Well,
thank you, Paul.
All right, thank you. And thanks to everyone for tuning into The Scope. If you liked our show and want to know more, check out phelpshealth.org.